Alrighty, hello everyone, welcome and thank you for joining us. As a reminder, we have you muted for our initial briefing. Once the briefing is finished, you can use the Zoom application to either raise your hand for a question or you can type your question in the chat. If you've called in via phone only, you can use *9 to raise your hand. In addition, please make sure you identify yourself by your full name and the organization or media outlet you're from prior to asking your question. With that, I'll turn it over to County Manager Mike Callagy.
Thank you, Denise, and welcome everyone to the Wednesday update. So today we're at 617. Again, yesterday we're at 589 as far as confirmed cases. We are holding at 21 deaths, which is, we don't want to see any more of those. So to the extent that that's good news, that's something we're hopeful we don't see any more of. In regard to some of the other statistics, we were just noting that of the 617, if you bring up this, that age group, 31 to 40, is leading the confirmed cases. And if you looked at 31 to 50, really that's the highest range group of all those categories. So I don't think a lot of people think of that this disease that way, that they're being infected at a younger age, but certainly the statistics in this county at least show that. You can see more females being infected than males. And then as you go across the way to death by age, you see what we had always feared, and that was the most vulnerable in our population, 81 years and above, are certainly impacted by this in regard to death more than any other category. If you go down to the next slide, is great. Some things to note here, and some things that certainly are encouraging, is that in regard to surge beds, of the 427 surge beds, additional beds that are available, we're using only 18% of that now, so we've got 82% available on surge beds in the county. And those numbers constantly change as we try to get more information in from all the hospitals and correlate that with the state surveys and our surveys, and some of that is really dependent on staffing. So that's, but that's overall good. I mean, great news that we still have that capacity, and that doesn't take into consideration the step-down facilities that we put in place in Burlingame and in at the event center with the 200 beds there, and the trailers that we have in place. So we're hoping that we've positioned ourselves in a way that we will meet any surge capacity and not even get close to that. And these numbers are encouraging right now. But I'll get to the modeling in a minute. We'll talk about that. Currently, we have 88 COVID-19 patients hospitalized. You can see with the ICU beds, we've got 60% utilized right now in the county with 40% availability, and it's of the 91 that are available today. And the good news, again, on the ventilators, which is critical in these situations, so those who are dependent on those for their life, we've got 31% in use and 69% available, which, again, is good news. Health is really focused on working with those 6 hospital partners in our county and preparing for the surge, and not only on the PPE side, but also on the availability side. We have a lot of requests now out for PPEs, so enough to carry us some ways through this, potentially up to 3 months through this surge. And in addition to working with our hospital partners, Health is also working with the 383 licensed facilities to make sure that they can meet the onset of needs also. In regard to communications, please, if you can pull that up. We've got a new billboard up on Highway 101 with a simple message, but profound: donate. We do need more donations to the SMC Strong Fund. We know that Gilead has donated $1 million to that fund, so we really appreciate that donation and hope others will follow suit. And Sam Cita was on a previous call today talking about the rollout of the SMC Strong Fund for small businesses, how those loans will be up to $10,000 and vary according to needs, obviously. They're engaging really the process now of trying to figure out that application process. And they're engaged with the San Mateo Credit Union to disperse those funds. So that's San Mateo County Credit Union, which would be terrific. They've got banks throughout the county here, which can really help us meet the needs of those who are in different geographic locations in the county. So we're excited about that. We did have a question the other day about domestic violence, and the volume generally on par from last year, maybe down a little bit. You know, there's a decrease in some specific programs, but more traffic to some of the legal lines and more complex calls on the legal line and different hotline and website page. They see more traffic too, but a decrease in overall calls for service or calls that are referred or cases referred to them. So that is good news, but we'll continue to monitor that and see how that plays out over time. We did also, an additional call, have a question about CPS referrals. Those are actually down also, but that is to be expected with school out. So we have not seen a spike there that some people have talked about. Census update, 54.5% response rate today to year to date. But we need to see that increase. So now we're going to begin in April 8th through the 16th to issue paper versions of the census questionnaire to households that have not responded. The paper version will be in English and Spanish. However, residents can complete the census questionnaire online or by phone or by email. Additionally, on food security, you know, we want to make sure that people are not insecure when it comes to food. So we had a Second Harvest on earlier talking about their efforts, and we will appoint kind of the food czar for the county, that person who will really work with the cities on the county side, and it'll be probably a department head, a person I'll name on Friday to lead that effort. That'll interact with the cities to see what they're doing, to see what their needs are, to see if they need volunteers to really outreach the most vulnerable members of the community to see if they need food delivered. But we will, and that person and their team will interact with Second Harvest and the pantries to make sure that everything is running smooth there and that there is no shortage. And, you know, as Second Harvest indicated on the previous calls, there may be shortage of certain things at times, like rice. I mean, it's just like anyone else trying to find rice now, it's difficult. But they'll try to substitute that with something else. And all those are just temporary type of situations that most of us are facing in any grocery store now. And I'd like to get back to that message. If people just kept shopping like they did, you know, 3 months ago, we wouldn't have any of these shortages. But there is no need to panic buy or overbuy. Maybe you want to limit your shopping to once a week and buy enough for the 7 days. That's terrific. But the message is the food supply chain is intact, and we don't need people hoarding anything. Everything that they want will be there if we just go back to shopping like we used to. Some questions that were submitted by the media. And I'll start with the first one. My understanding from the Mercury News is that 15 of the 21 people at this writing have died in assisted living, nursing home facilities, etc. Is this accurate? I would say no. I don't know who's died in any given location. I think that we do, as I mentioned earlier, have seniors that have certainly passed away. I'm sure some of them did come from, and I think that the chief of health mentioned it the other day, that some of them did come from congregate living, or maybe 15 of them came from congregate living facilities, but I don't know if any of them died in those facilities, and we don't give out information as to where people died anyhow. But clearly some of our older population has been the subject of most of these deaths, and I think that some of those did, maybe the majority of those did come from congregate living facilities. And then we're asking, the next question was, how are we making sure facilities for the elderly are safe? Should people pull their loved ones from the nursing home. It's really the state's responsibility to do that, and they are doing this really on a regular basis now, visiting these centers. There's guidelines for all these centers. And the question is, should people pull their loved ones out? And the answer to that is simply no. Should not be pulled out of these nursing homes where they may have better access to care than they would at home. So no, we don't think that is the case. We do believe these facilities are licensed by the state, and certainly we don't have jurisdiction in them, but we know that the state is following up, and the state guidance for isolation and best hygiene practices are constantly the subject of reminders to these locations, and they are really really adhering to those in cases that we've come across. Also, the modeling for the peak. Next question: the modeling for the peak in light of this Institute for Health Metrics and Evaluation, which is promising. How many models are being considered? Best estimates for when our peak will arrive. This is something we're really interested in too and concerned about. The IHME is one of the models that we're looking at. There's several models out there. We're trying to correlate and really kind of come up with the best model possible. We're working on it internally here. There's a state model, there's a nationwide model that we've seen. But really that's what we all want to know, right? Because that's what's going to drive us to determine when the surge is, how many beds we need, how many ventilators we need. So we're all interested in that modeling, and we hope to have more information on that next week. We will be happy to share that with you when that comes out. Next question. You said yesterday our emergency cash supplies is at red line, so we desperately need these. What does red line mean? It really means that we're at the point where our demand is exceeding our supply. We probably right now couldn't put together a complete PPE outfit if we had to, especially the booties. We're completely out of booties, which is something that we've ordered. We've got millions and millions of dollars of orders out there. They'll come in at various times. We continue to update you. We will continue to update you when they do come in. We know that the government, the state has ordered a lot of these supplies, but we want to get to the point where we make sure that we've got that emergency supply back where it was before, and that the supply chains are working for all the hospitals to individually buy their supplies. So we look forward to that time. In the meantime, we have a lot of supplies coming in. Are there sufficient medical facilities in place for the peak? If not, where is it lacking? If yes, at what point can healthy people return to work since we are prepared for the surge? Well, I can tell you, looking at these numbers, we are in good shape now, but we don't know what that surge is. And if people did return back to work prematurely, we can certainly say that surge would be much higher and would potentially exceed what we have in place now. I can tell you that the curve, by staying at home, sheltering in place, the smoothing of that peak is working. We can see that throughout the county, throughout the state, throughout the nation, for that matter. But what happens when you do that is you do prolong that period. So we won't have that sharp spike, and then the drop. We'll have a situation where we smooth it, and it's longer going out into the future. And you say, well, what's good at that? And the reason that is so good is that we will have the ability to take care of those who need help in the hospital. We'll have those available beds. We'll have those available ICU beds. We'll have those available ventilators. And then all those folks who would come in and have, maybe have a heart attack or a stroke, and all those people that we naturally need to take care of, there'll be space for them too, because the surge not only affects those with COVID-19, it affects those who can't access healthcare because that are in emergency need of healthcare, like those ones we talked about, serious car accidents and strokes in hospitals and those type of things, because there are no beds, or there are no doctors, or there are no ventilators available. So it's a twofold impact that we're trying to have here. Sacramento has released cases by zip code, and any thought to doing that here while recognizing the cases may be spread out and originating elsewhere. No, and we really don't see, our health officials really don't see any benefit to doing this. Again, I think that the message is we need to assume that COVID-19 is in everyone we talk to, that in every cart we touch, and every door handle we touch, so that we have to take precautions. The amount of COVID-19 in any given zip code is really irrelevant, because you're right, we don't know where it came from or how it got there. It may be interesting, but it's not relevant, and it can give people a false sense of security that we only have a couple in our community, and that is just not the case. Any progress on getting information on cases in which someone reported positive for coronavirus but has recovered? I can tell you anecdotally that we have 619 confirmed positive cases, and we've had 21 deaths to date. So the vast majority of people really are recovering. We don't have those specific numbers now, but don't let that 617 be misleading. We probably have many, times 5, 10, maybe even 20 times that amount that would have been positive, didn't realize it, maybe asymptomatic. So the vast majority of the people are recovering. To the extent that we have better numbers on how many people have taken tests, I think that would be interesting, and we'll try to get that information for everyone. Along the same lines, though, we do want to, going back to that zip code, we do want to give you more specific information as far as ethnicity and those things. To the extent that we can collect that and get that for you for this county, I think that really helps inform us more about what's going on, and maybe areas that we need to be more cognizant of, and to the extent that we see patterns here, that we would be able to address those patterns. Certainly, if we see a spike in a given zip code, that would certainly pique our interest, and we'd ask why and what's going on there, and is there one super carrier in that area. That is something that we're very interested in. And along the same lines, we've asked the governor's office now to really allow us better access to testing for those essential services workers. That would not only include your frontline public servants, in health and those in the private hospitals in health, but first responders and even grocery clerks and those who work in pharmacies and those who could be super carriers if they came in contact with someone and they did have COVID-19. So we believe it's essential that we lower the bar, get more of these people tested, that we create their own lane for on-demand testing for those folks. We do know through Verily the turnaround time is coming down on results, which is great. There's a lot of things going on that front as far as future of testing and what kind of tests there'll be and how readily available they are. So more to come on that in the upcoming weeks. So while shelter in place is aiming to keep the population healthy, has there been a thought on how to balance that with the negative physical and mental health impacts of sheltering in place? Yeah, that's a concern of all of ours, right? And part of the planning, and I should say that IEM had the kickoff meeting yesterday with a large group, as I mentioned before, that the strategies we're really looking at are what are the 30, 60, 90-day strategies for dealing with this. And then what are the strategies we can employ when we try to restart and reopen society? It won't be a flick of the light switch where everything's open at once. It'll rather be probably, we're seeing this now as a more gradual approach, more strategic approach to reopening. What does that look like? Because we don't know what that looks like. And then the third part would be, how do we prepare if we have to go into a second wave of this? How do you prepare psychologically and financially and organizationally and medically for another phase if we have to get to that? We want to have all these things in place and really think these three things through. So we're constantly, trying to balance that physical and mental health about the impact. Not to mention, and I think that's why it's important that people do get out and exercise. And within that 5-mile radius that the health officers have implemented in this county. So, it is an opportunity to get out and walk around and keep, physical distance and wear that face covering while you're out and about. It's a good practice, just leaving in general. Is the event center testing site still under capacity? Absolutely, and that's why I think I addressed this earlier. We're trying to get that increased we believe they can do much more than 250 to the extent they have the test kits available to do that. We would like to see as many as possible go through there, and again, create that special lane on demand for testing for those who are in the essential services, not only public, servants, but the private hospitals and all those in grocery stores and pharmacies and those who are serving our public and remain open. And we depend on those services for our everyday needs. So with that, is there any questions?
Yes, there's one raised hand. Henrietta J. Burrows from EPA Today.
Yes, thanks so much. I have two questions. One is a follow-up to what you just now said in terms of the statistics. You said, don't fool yourself, there might be more cases. And my question also relates to a question that was asked of Governor Newsom today, and that's about the accuracy of the figures that we're being given. Since people could have gone to the hospital, could have gone back home and then died, and since there's no widespread testing, how do you really verify the accuracy of the figures that you're given? Should it be better to say they're approximate?
Well, no, the figures we're given are accurate, that we know, the total cases tested. And as far as the deaths, those are the ones that have been certainly called to our attention, and that we can directly relate to that. But you're absolutely right. Like I said, as far as the total cases, we know that there's many, many more people out there that probably had COVID-19 and didn't even realize it, were asymptomatic or had mild symptoms. Or we've got many more people who are in the testing process. There was a huge backlog that they're trying to get through. I mean, a week ago, there was, 10,000 cases that were backlogged. So we don't know, how many of those are still pending, but the turnaround time is getting better. So we're still trying to correlate these numbers in real time, and that's always difficult when you have a dynamic situation and you don't have widespread testing. That's why we want to focus on getting people tested, either for those who serological tests that will show antibodies, or the test that will show if you have active COVID-19. Now, we think that that's where really the future needs to be, as far as making sure that we test as many people as possible to determine what the numbers really look like and what we can expect. The numbers for active cases right now, it helps us really decide for a surge what that looks like. So, and those are very important. And then for those who have maybe the immunity that because they've had it and didn't realize it, that will give us some information on maybe how to reopen society and what folks, how much of the population can move forward and start to reopen.
Now, my second question, if I can ask it, you said in the beginning that there were more women who had coronavirus than men, statistics shows, and in other localities, there were more men than women who are victims of the virus. Right. So any explanation of why in San Mateo County there are more women than men?
Well, I don't think it's a hugely significant, statistically significant number. I mean, you're looking at, and we're only talking about the people tested, of course. We don't know how many people actually had it and were tested. We're talking about 330 female cases and 286 male cases out of that 619. So it's not that significantly different, and it's just it could be just in this case that more women have gone in and sought testing than male, and that number could change next week as we get test results back. So I wouldn't read too much into that.
Thank you.
Anything else, Denise?
Those are all the requests, raised hands, and there are no questions in the chat.
Great. Thank you all for joining us. We will be back on Friday at the same time. Thanks so much.